Good morning, and thank you all for being here with us today. My name is Bill Mincy, and I am the National Chairperson for Pharmacy Choice and Access Now, also known as PCAN, and which is a national coalition of consumers, local pharmacists, and business owners that are committed to preserving the quality and affordability of healthcare and pharmacy services. I'm also the Vice President of PPSC, a pharmacy services firm based here in Tallahassee that serves over 1,300 independent owners. I'm joined here today with many great partners in support of Senate Bill 702 and House Bill 745 in an effort to make the pharmacy audit process a more efficient and effective process for pharmacy owners, pharmacists, pharmacy benefit managers, also known as PBMs, and ultimately for our patients. PCAN is very grateful to have many supporters with us today to talk to you, including Senate Bill sponsor, Senator Aaron Bean, House Bill sponsor, Representative Travis Cummings, Ron Pickens, owner of By Right Pharmacy, Michael Jackson, the Executive Vice President and CEO of the Florida Pharmacy Association, Larry Gonzalez, General Counsel of the Florida Society of Health System Pharmacists, George Chamizo, Representative for Independent Pharmacy Cooperative, and Jim Powers, Representative for the Florida Independent Pharmacy Network. All of us have come together under one umbrella to support this legislation and promote its passage this year. To give you some background, PBMs play an important role in the delivery of pharmacy benefits, acting as an agent on behalf of insurance companies, government programs, and other healthcare payers. As a part of their role, PBMs conduct pharmacy audits, which were originally intended to prevent and address fraud, waste, and abuse. However, over the past years, many pharmacies have experienced excessive auditing practices by these PBMs, and as a result, pharmacies have been denied payments or had money recouped for what should have been considered proper filled patient prescriptions. This situation has occurred on multiple occasions to many community pharmacies throughout Florida. It's important to note that currently PBMs are highly unregulated, but Senate Bill 702 and House Bill 745 set standards for the PBMs when conducting their audits on pharmacies. It maintains the integrity of the auditing process to catch bad actors. And finally, it allows pharmacists to focus on what should be their top priority, which is serving their patients. With that, I would like to thank Senator Bean for being here today and welcome him to speak on this important topic. Senator Bean?
Thank you very much. Thank you. Good morning, ladies and gentlemen. I am Aaron Bean. First of all, I'm just delighted that so many of you have come out to hear our plea, I guess, when dealing in the situation that pharmacists face. I first of all want to salute my good friend Jim Coivisto. Jim runs a mom and pop pharmacy in Jacksonville and has a sick wife and is doing the right thing by staying home with her. But Jim and others that have been instrumental, we salute them. You know, I was just thinking, when the Florida panther was in danger, our state stepped up to protect it, as we've done with the American alligator and the southern gopher tortoise, southern gopher turtle. We have stepped in because we realized that they were precious, and that if the government didn't step in and do something, then it was an endangered species and would forever be threatened off the face of the earth. There is another being out there, another entity that's also facing hard times and will not have a bright future unless we step in. And that is the small mom and pop pharmacy. You know them because that's where most likely you may have gotten a prescription filled in the last month or so. They're on every corner. They're on Main Street. You name the town, yes, in Fernandina Beach, but Bradenton, Zephyr Hills, all over the place. they're threatened right now because of the way that we do business, the way we force them to do business. Now you'll say, well, it's a private contract, because that's what some of my colleagues said. That's what I've said at first. I said it's a private contract, but when you look at the parameters of how you do business as a small mom and pop pharmacy today, you have no choice but to deal with these pharmacy benefit managers. They're doing what they do best, which is to make a profit for their shareholders. Mom and pops, though, have no choice but to deal with them. And so all we're asking for, and all the bill does, is set up some fair parameters. We're not trying to hide anything. We just want to do business. Our priority for these mom and pops is to fill prescriptions for the good Floridians that depend on them, that like coming into a shop where, just like on Cheers, they know your name and they know all about you, and they know to tell you that maybe this is not a good time, or not to eat this on a full stomach or an empty stomach, or whatever it is. It's such a delight to go there. Now, people that have joined us, yes, Walgreens and other Publix, and we're delighted to have some other pharmacies, bigger pharmacies, join us, and we welcome their support. Even though they want this legislation and we need their support on this legislation, the regulations that PBMs continually to put on them, they have the resources. They have the resources to deal with it whatever day that they're audited, or whatever surprise audited, or however many people they need to pull aside to comply with these overly intrusive audits. Not all of them, but a lot. But the mom and pop pharmacist, it may just be a one-man or a two-man or a two-woman show, and so they need help. And what our bill does, and then Representative Cummings is my great partner in healthcare. In just a minute, I'm going to ask him to come up and talk about some of the specifics of the bill. But we're just asking for what's reasonable request of that you would do if you ran a business, or if you were in partner with somebody else. These are reasonable things to ask for. So that's what I'm doing to sell it to my colleagues and sell it to other committee members and other senators. Representative Cummings is doing the same thing. If we don't act, our mom and pop, our small pharmacies are in danger, and so we are acting. Representative Cummings, come on up and tell us the good news of what these bills do.
Great. Thank you, Senator.
Go get them.
Thank you. House Bill 745 is something that obviously I'm appreciative of all the stakeholders, including Senator Bean, who this is a testament of sometimes bills take a couple years to get going and moving through the process. I know as it came to Senator Bean last year, he looked at it. He obviously was cautious and took the off season to do what I've done over the last couple months, and that's meet with individual pharmacists and independents in our region in Northeast Florida. And I've found what Senator Bean has, and that is there are some very significant onerous audit practices, lack of notification, and many other issues that if you've heard the testimony that I think we have, you would, those that may not be knowledgeable of this issue or be supportive at this point or even be neutral would definitely have their opinion swayed. I will say, as I think Senator Bean would agree, there are a couple PBMs out there who have been very professional, very accessible to meet with both Senator Bean and the stakeholders with the pharmacies to try to see if there's some ways that we can do what roughly 25 other states have done across our great country, and that is clearly have some standards and clarify some language, as well as focus on those that are conducting fraudulent activity, which we all can relate to, and all the good actors, which are most of pharmacies throughout our state, can attest to. And there's no one that wants to penalize and hold them accountable more than the independent pharmacists themselves that are doing business the right way. So unfortunately, sometimes here in Tallahassee and in local government as well as federal government, we focus too much on those bad actors rather than really those mostly that are doing a great job and therefore in conducting business in an honest way in the utmost standards. So I would say that this obviously legislation with House Bill 745 and our Senate companion, who's doing a fabulous job moving it through the process, we would take those unintended consequences and provide not only more flexibility but really more more fair standards that we think are already occurring in other states that would allow them to practice business, be successful. You know, a lot of folks do not realize, but if you look at these independent pharmacies in the various communities, it really are the lifeblood for not only medical care, but other types of you know, services as well as products that are sold or in a lot of our lower income communities throughout our state. And it is unfortunate that we've had to act on this, but we think it's very responsible. Next week in Health Innovation, which should be the first stop for House Bill 745, we feel that we'll have an opportunity to present the bill, and I will do so. And once again, thank you for all those that have weighed in, provided more information and support for Senator Bean and I, and we look forward to working through the process on what we think is very good policy for the state of Florida.
Senator Bean and Representative Cummings, thank you so much for your concern about Florida's communities and small businesses and the small pharmacies. We appreciate your leadership and your support, and we're going to work with you. I'd next like to introduce Michael Jackson, Executive Vice President and CEO from the Florida Pharmacy Association, to say a few words.
Thank you so much, Representative Cummings and Senator Bean, for being our advocate on this issue. We are very important. This is a very important issue, and we really would appreciate your support. My name is Michael Jackson. I'm the Executive Vice President and CEO of the Florida Pharmacy Association, and I'm very proud here to be today with everyone else to support Senator Bean and also Representative Cummings on this great and important legislation for our state. The standards addressed in this bill is designed to help ensure that pharmacy audits remain effective, predictable, and fair for pharmacists and pharmacies. Our members play a very, very important role in our communities as trusted partners to our patients' health and well-being. Beyond providing care for patients, our pharmacists have daily business challenges as well, and this will help streamline the important audit process and ultimately the good for patients and also for consumers. And again, we want to thank Representative Cummings and Senator Bean for being an advocate on this issue, and we will be looking forward to working with you as you move this legislation forward. Thank you.